Specialist, Credentialing and Accounting, EMR and Business Practices. She's a member of the California Medical Group Management Association. She's been working with Dr. Takibana, who will be our next speaker, towards the repeal of Obamacare and research involved in the Patient Protection and Affordable Care Act. Please welcome Pam McDonald to the stage.
I want to thank everyone who made it possible. That shortness of mine is the way I want it. I wanted to thank the members of the El Dorado Hills Tea Party for inviting me to come here and speak to you about what I've been seeing with the transformation of our health care over the last, well, I've been working in the field for 43 years, but I can say that in the last 10 years, I've been really alarmed and really upset and have become an advocate for the physicians and for the people, the patients that we see, because the changes are causing a situation where I think the difficulty of the physicians that are able to stay in practice and take care of their patients the way they wanted to is rapidly being eroded. My job is to help physicians in every way, in every aspect with business, because they are in the business of providing health care. We are small business, and we are affected just like everyone else. But we have more rules, more regulations, and we are in an industry where mistakes are not tolerated, where there's an elephant sitting in the middle of the room right now, because what many people don't understand is we talked about the implications of Obamacare, but I am seeing doctors leaving practice, leaving the state of California. When I first started my medical consulting business, my job was to set up doctors in practice. They wanted to come out, they wanted to perform good medicine, but they don't know a lot about business. Some do, but most of them don't. And so they hire a person like me in order to be able to handle all of the things that it takes to become a physician, to have their own practice. Now, my job is helping them wind down their practice because they're retired. I think people don't realize that we are losing our physicians, our primary care physicians, at a rate that is unbelievable. We have lost, in the last 5 years, 60% of all of our primary care physicians. They're gone. They can't survive, and I'll tell you the reasons why. First of all, as they said, I am a third-generation Californian. I'm a native Sacramento. I've been in the healthcare here in Sacramento the entire time. I have a hard time right now because I am approaching Medicare. I had my 64th birthday this year, and knowing what I know from the inside out, I'm afraid that I am not, under Medicare, going to find a doctor that will treat me, or maybe not be able to get the medicines that I need. and certainly not services. I was supposed to. Okay, thank you. This is a cartoon about something that's very serious. And maybe some of you have already lost your doctors. Maybe they have gone, have informed you that they are retiring, or that they're going to move out of the state. I assure you that they are already implementing, thanks to this, they're already implementing their preparations with us in order to bring about Obamacare. Right now, what has gone on, I need to step back, excuse me. The Centers for Medicare and Medicaid and the Department of Health and Human Services, they control what we charge, how we practice, how much we will get paid, and what procedures we can and cannot do. That control has become significant. They, here in California, our governor and our legislature has decided that they're going to be the leader. They want their own state universal health care. Never mind, we can't even manage the Medicaid or Medi-Cal at all. It's rife with fraud, and it's the lowest reimbursing Medicaid program in the nation. Because of this, people who are on Medi-Cal have serious difficulties in finding a doctor that will treat them, because we have to come out of pocket approximately $40 for every patient that we see. And doctors are not rich. I mean, maybe a long time ago, some of the specialists were. Right now, plastic surgeons, cardiologists, they're having a field day. But no more. They have cut everything back, the reimbursement back, and the people that have Medicaid are showing up in our emergency rooms. How many of you have been in an emergency room in the last couple of years? Yeah. And did you wait a long time in that emergency room, and was it crowded? Yes. Why? Because there were so many people there that either didn't have insurance for various reasons, or people that were there on Medicaid who were getting their general health care. They were there because they had colds, and they had this, and they had that, because there are no community clinics that can handle this. There are a few, but they're overwhelmed. And so the doctors can't see them, so they go to the emergency room. And we have a group of young people right now that think they're invincible. You know, I did when I was young. I'm never going to get sick. But I always had health care because I worked in the healthcare field, and I know that you can. You can have an accident, you can have appendicitis, you can have amazing things happen to you that you don't prepare for. But we have a generation of people now who have no responsibility, and they get offered their health care insurance, and they don't take it from their employer. Maybe they have to pay a portion of it, but they say, why do I have to to spend my money on that because I'm healthy. I'm 25 years old. What's going to happen to me? Plenty. I have a car payment. I don't own a home. So I go to the hospital and my visit for emergency room is $10,000. Good luck. Collect it. You know, your hospital is in the business of providing health care, just like your doctor. And the reason your $12 aspirin and your $50 box of Kleenex is the way it is because of these people that walk into that door and avail themselves of services. And then they don't, the rest of us have to pay for it. And so some would say, well, that's an argument for having socialized medicine. Well, with socialized medicine, everybody gets it. It's not free. Who pays for it? For the people who have it for free. Or the subsidized. We have a subsidized program right now with Blue Shield of California, who who will end up being part of the health insurance exchange when the dust settles. I predict by what I'm seeing on contracting and by what they're doing to us now, I can predict that they will be players in the health exchange. The pharmaceutical companies are all vying for the option of having this few companies that will provide all of the drugs. But the health insurance exchange, they're working on it right now. Okay. I want to go over some terms because unless you're working in a field where you've dealt with this, you don't know exactly what we're faced with or what we have here. Before Obamacare came along, the Centers for Medicare and Medicaid started reducing, well, let's just put it this way. They have always dictated to us how much we will charge on how much they will pay. And all commercial insurances follow suit. With the logic that if you contract with them, or you contract with the government, and the government says they're going to pay you $100 or whatever, then everybody else is going to go along with it. Some of them will pay less. And so we have had, because Medicare and Medicaid has been out of funds for some time, but they haven't talked to us about that. President Johnson, took care of the trust fund, and he for his Great Society. He took the money that's coming out. Now, we're all paying into this as we work, and as our employers go. And they decided that they should have that money. And so the powers to use this money and go into the general fund, and then it was distributed. And it has not come back. Now, as we work and we contribute, that is what's running and paying for Medicare today. But us baby boomers are creating a huge problem. And all of the people that have come into this country illegally or Medicare and Social Security. And they have not paid a dime into it. So is it any wonder that it's broke? And now, to fund Obamacare, they've taken $716 billion out of the imaginary money that's in Medicare, which is really the money that's constantly flowing in, to set up certain bureaucracies to manage this, because they're very far short of what their estimate or what the CEO said that they were going to have on hand to implement Obamacare. What does this mean to doctors? This means that we're going to be faced with ever declining revenues. The SGR that I put up here, that's a sustained growth rate. That's the formula that CMS uses to reimburse physicians, hospitals, all healthcare providers. That, when I started, I think it was in 2006 or 7, I got involved because they were going to cut doctors and healthcare provider reimbursement by 16%. 16% off the top. And we were barely making ends meet as it was. Because in the healthcare field, remember, we're a small business, and we are in the business of providing healthcare, and our overhead has been going up because everything that happens to business happens to us and more, because we have malpractice insurance that we must pay for all of the lawsuits that come our way, perceived or not, whether they're wrong or not, they can sue us. And so this SGR has escalated. I work with the California Medical Group Managers Association as an advocate, and I went out to all, or attempted to, in Northern California, meet with all of the congressional representatives and senators. Not very many of them would talk to me. The ones that did, give me the time, and then they ended up not doing anything about it. Congress, it's a hot potato for them. And always their deadline to make a decision about this comes up just before an election. And so they kick it down the road, and they end up saying, no, we're going to postpone it for another 6 months. Last year, they did it to us 4 times. Every time they do that, the amount goes up that they're going to do. The last time this year, it was 27.4% reduction. That's a quarter of our income. How can we stay in business this way? We can't. Now, they did it again because they were supposed to make a decision before the primary. And of course, they didn't want to do that. They went off on vacation. They left us sit here. And next time, I think it's going to be probably around 30%. And that next time is the week after the general election. Okay. So what it's doing to us is that it is keeping us from having. Let me get through this. It's keeping us from having any idea of whether we can continue on practicing medicine, keeping our doors open. And so you are going to see more and more and more doctors leaving lives allocation because we can't stay in business that long. I have more to say, but of course, it's really hard. A lot of what I had planned to tell you was already said and will be said after me. So I don't need to describe to you about what's going on with Obamacare, but what I want to impress with you is that you are going to have ration health care. By virtue of the fact that the doctors cannot stay in the business of providing your health care. And, you know, it's something that you have to remember when you go to